Okay, let's welcome Dr. Popper and Dr. Goldner. Hello, Dr. Goldner. Nice to see you again.
Good to see you too.
Thank you. Hi, Dr. Popper. How are you?
I'm great. It's great to be here again.
Okay, great. So it's a great opportunity for all of us to get two very knowledgeable, articulate, confident women who are leaders in the health field. So we're very grateful for this opportunity. So why don't you first, just by taking 30 seconds to just tell us what you've been doing the last few years for people that are not aware of you. Dr. Goldner?
Oh my goodness, what have I been doing? So for people who don't know me, so I myself am an autoimmune survivor. I had lupus for 12 years of my life, almost died many times, kidney failure, blood clots, many strokes. So I went to medical school hoping to help other people with chronic disease manage their pain without trauma. Along the way, I was able to develop a protocol along with my husband, Thomas Tadlock, that actually successfully reversed the lupus, and I've been free of disease for 17 years. So we have given that protocol away for free for the public. I constantly am doing free Q&As for the public, classes for the public, because I want this to be a way of life for everyone. I want everyone to be able to grow old with the person they love and to be able to have children, things I was told I could never do. And at this point in time, tens of thousands of people from all over the world are free from autoimmune diseases like lupus, rheumatoid arthritis, multiple sclerosis, Sjogren's, mixed connective tissue disease. From my free content alone, personally, I've worked with thousands of people in reversing their diseases successfully. So yeah, I've been doing a lot of things. Yes, I've written books. I'm the first plant-based doctor in the Forbes Health Advisory Board. So that's been an exciting development this year because of how well our protocols worked for the public. But mostly I'm seeing clients. I'm helping people every day. Whoever can't do it for free, then I take the time for most people to work with them every single day so that I can help them do what it takes to get better and get their health back.
Thank you. Dr. Popper?
Well, I've been doing the same thing for the last year and a half that I was doing before. Our company specializes in informed medical decision making, and we assist people in learning how to read the medical literature and interpret it properly so they can make good decisions about their health. And we do business in 33 countries. We have members in 33 countries. We own a school that teaches health professionals how to be in the business that we're in addition to the practice specialty that they might have. And so I think it's just all the same thing, only we do more of it every year, which is great. And the need for it, I will say that the last 3 years has motivated a lot of people to feel like they need a better understanding of what they're doing and why they're doing it. And so we've seen a huge increase in the number of people who are contacting us and using our libraries and asking for help and learning how to do this. And my best moments, I love when people get well. And I also love when a person goes back to a physician or a dietitian or whoever they're talking to with a good understanding of what the options are and the risks and benefits, and can have a conversation. And I'll tell you something that I've found that's been really reassuring or refreshing, and that is that a lot of health professionals light up when patients take responsibility for their health. And people who've told me that their doctors aren't interested, they change their stance when a patient comes in and is interested in helping himself or herself. So that's been a nice development too, as I'm seeing more people in the medical profession kind of coming around to this idea of patient engagement.
Great. Okay, so the first question is, a lot of us are very concerned about cancer, heart disease, Alzheimer's, but a lot of us are not really up to speed of what autoimmune disease means, how many people get it. Is this a big deal, or a lot of people getting this? Is this something we need to know anything about? How many people even have autoimmune disease?
I'll let you go first.
Okay. So autoimmune diseases are diseases in which your immune system, which is normally responsible for protecting you against things like infections, inflammation, actually takes over. And the immune system suddenly starts attacking your own tissues. And which tissues get involved really depends on the disease itself. So rheumatoid arthritis, people develop mostly joint pain, although they can also have things like brain fog and fatigue. Scleroderma would be skin. Sjogren's is your different types of lubrication, eyes, mouth, and other areas. Lupus can be anything. It can be in the heart, the lungs, oftentimes the kidney. And what's really important to know is that autoimmune diseases are on the rise. So while it was considered something that was more rare when I was diagnosed at 16, 30 years ago now, when I was diagnosed, they thought lupus was fairly rare and it was hard to diagnose. Nowadays, it's not. And what researchers have recently found is that autoimmune disease is on the rise by anywhere from 3 to 9% per year over the past 40 years, and have been spreading into areas of the world where it was not available, where we weren't seeing it before, like Crohn's disease in the Middle East. And so some researchers at London Frick Institute were trying to figure out, they're genetic researchers, and they were trying to figure out, is there a genetic cause? Why would autoimmune diseases be rising so precipitously, so much over the past 40 years? And they were thinking there'd be a genetic component. And what they actually concluded was that the rise and spread of autoimmune disease exactly mirrored the rise and spread of the Western diet. So it's really just confirming with those of us, I'm sure Pam Popper's not surprised to hear that. And a lot of the people who have been teaching here are not surprised to hear that. But a lot of the population, that was news. It's actually a mobile news show was talking about that, because people are surprised to hear it, that they're familiar with the idea that there might be a food component to diabetes, cancer, heart disease. But with autoimmune, they've really tried to say it's purely genetic, and it's not the case. I know that because it was my diet that got rid of my disease. And so current studies are really just showing what we have already been seeing for a long time, at least in our practice, and the power of autoimmune disease, or power of diet, really, in autoimmune diseases. So yeah, the numbers are kind of different. It depends. Like with lupus, they say maybe there's about 5 million, but they also say that most people are undiagnosed for years, maybe even a decade, before their doctor figures it out. So I think it's much more than people think. And either way, it's dramatically going up, and it's connected to the way we eat.
Yeah. I would echo that. And the thing that I have noticed that's even maybe more terrifying is the average age is going down. I've been in business for 27 years, and maybe once a year we would be contacted by a parent who had a child with juvenile rheumatoid arthritis or inflammatory bowel disease. And now that's an everyday occurrence. And so I think we have a generational problem in terms of food. And one of the ways that I explain this to parents is, I'm 66 years old. So when I was a kid, there wasn't any such thing as kid food. It was just food. And I grew up in a family that, at least when I was a little kid, didn't have much money. So scratch cooking and gardens and that sort of thing were kind of how we lived. And so everybody ate the same food. Now we have probably the 3rd or 4th generation of people eating kid food, which is just a code name for garbage. And so the diets are starting earlier and earlier to be terrible. And that's bringing the disease on earlier and earlier as well. And I think that's the most terrifying thing, because if some of these children are not shown how to eat their way and change other factors that lead to autoimmune disease, their lives are going to be shortened. There's no way you can be diagnosed with Crohn's disease at the age of 5 and take drugs and expect to live your full lifespan. It's just probably not going to happen. And that's a terrifying thing for a parent to have to face.
And it's an excellent point, and it's across the board, right? I mean, I just a couple of weeks ago was asked to talk on the news about how now they're finding colon cancer is surging in people who are in their 20s. And before that, I had to do one on how many kids now with type 2 diabetes, how much more there are than ever before, and how kids are having high blood pressure. I mean, when I was in medical school, there was no type 1 and type 2 diabetes. It was adult onset was the one that was type 2, because kids didn't get it. And now it's common for kids to get it. So we have a rise of disease in all areas in children, even things like depression. So I definitely echo what we just heard, that, it's the poor eating that we have in our world, and how it's spreading throughout the world is causing children to get sicker across the board. Although they only like to talk about one news story at a time, it's pretty clear that our children are sicker than they've ever been. And even 10 years ago, they were saying that the next generation of kids are not going to outlive their parents, where in the past, every generation did better. We're going the other way now.
Yeah, absolutely. And I was asked on a radio show a couple of years ago, this was kind of an interesting thing. The person interviewing me said, what would you say is the most difficult challenge you face when you're working with people to change their health? She says, I bet it's trying to talk them out of eating dairy. And I said, well, first of all, we don't try to talk people out of doing anything. We think that showing evidence and then letting people decide. And most people, when they look at evidence, they do decide to, for example, stop consuming dairy products. But I said, that's really not it, because it's pretty clear when you show people the evidence that this is not a good food for humans. You know what it is again, going back to my childhood, and I know I sound like I'm 197 years old, but yeah, and I was walking to school uphill barefoot, but really when I was a child, my grandmother and my mother both shared a common habit, and that is they would figure out what we were going to eat for the week, and then they would make a grocery list, right? And go to the grocery store and buy food. And I remember my mother taught piano lessons a couple nights a week, and my father, she'd leave instructions on the refrigerator for what he was supposed to make us for dinner, and the ingredients would be in the fridge. So eating was planned, and it was planned for health by default. I mean, again, we didn't have money to buy thick steaks every night and that sort of thing. And the stores were not full of ice cream and all the other garbage that people take home. So when we start working with people, one of the biggest challenges we have is showing them that you can't just wait until 5:45 and say, gosh, I wonder what we're going to do for dinner. Because that's, people stop by Applebee's to pick up food, and it's not because they actually think that that's a good idea. It's just they don't have anything else in mind, and it's crunch time, And we spend a lot of time in our office working on those issues with families.
Okay, so let me skip ahead to the last question, then we'll come back. The last question is, okay, so assume we follow everything you suggest perfectly, and assume that, people are listening to you carefully and doing it. What are the results? I mean, are you saying that if you see 1,000 people are all cured and live to 110? Or do people still get cancer and heart disease and still get autoimmune disease? Like, how well does this protocol work? How many times does it not work? What's the benefit of following your lifestyle approach versus some other one? Is it work? What percent of the time does it work? How often does it not work? What are your real world results with your patients?
I'll let you go first.
I went first last time. Go for it.
Okay. All right. Well, I think the first thing is the results are highly variable because the people present themselves in highly variable conditions. In other words, there's a difference between somebody who is diagnosed with rheumatoid arthritis, for example, a few weeks ago and is just starting to explore what to do and ends up finding us before they've been ravaged by the drugs that are actually not so effective and can make things worse, and years of bad eating and that sort of thing. So that person is going to have a better outcome than a person who has 6 or 7 autoimmune diseases, and the first one started 40 years ago, because the likelihood that you'll develop more than one autoimmune disease if you have one is very great. And so you're going to see a lot of highly variable outcomes based on the condition of the patient upon arrival, the how much drug treatment they've had, the mindset. We call it the X factor in our office. I've seen people who you would not think could get well who do, because they make up their mind to, and I've seen people who should get well who don't. And there is the X factor as well. The other thing that I tell people is it's always worth doing. In other words, if you take a look at the progression of autoimmune disease, you will develop more autoimmune diseases, and your life probably will end early. That happened to my mother, by the way. It runs in my family as well. And so if you can live your full lifespan, even if you can't reverse the disease, that's a win. And I think the beginning, I don't want to promise outcomes to people. I think it's irresponsible, but this is a way that I explain to people how this works. Let's say you walk into my office, I have this huge gash on my arm, and I'm dripping blood on the floor, and I'm picking at it, okay? And I'm complaining the whole time while I'm picking at it that it won't heal. And at some point in time, you, the client sitting across the table from me, might say, you know what? If you stop picking at that sore, I bet it's starting to heal. I bet it will start to heal. And they would be right about that. So the first step is you stop picking at the sore, which is you clean up the diet and all that sort of thing. And then you just see how far you can get in recovery. And sometimes it's astounding, the ability of the human body to restore itself to health if you just do the right things. So you can't guarantee an outcome, but you can guarantee that if you stop picking at the sore, things are going to start to get better. And that's the dietary change that can lead to better health. Maybe not entirely recovered health, but better health. Couple examples I'll give you, and then I'll turn it over to Dr. Goldner. I have a couple of rheumatoid arthritis patients who came to me after the disease was already progressing. And you can see some misshapen joints, and that doesn't reverse itself. But they're not taking any medications, and it hasn't gotten any worse. One of them for over 20 years, which is remarkable, because had this person continued down the path of conventional medicine and just taking drugs and not changed the diet and all the other things that we have talked about, by now, I'm sure would have been in a wheelchair. Again, I saw that happen with my mother, who had rheumatoid arthritis and wouldn't listen to me. Can't be a prophet in your own land. So
I always say it's hard to raise your parents.
very.
Yeah. So I have a different experience in all of this, and also what I can say is that while I agree that, you know, every person comes with a different story and a different background, what I've been able to see is that when people do apply hypernourishment, which is what my protocol is called, to their life, their health always gets better. That there is no downside, unlike a lot of fad diets out there. It's not like you start eating lots of nutrient dense, healthy food, and then some people get better and some people get worse, right? People's health gets better, and it starts to get better fairly rapidly. It's the only reason people know who I am. I was purely organic over a short period of time where people just started getting better and sharing it. And I went from a doctor treating the homeless, trying to be an unknown, to doing things like this, right? And so my protocol is very specific for cellular repair and autoimmune function. So when people start applying the nutrition to their lives, their health starts to get better. Now, how well they stick to it, now that starts to make a difference, right? And so what I found to be the most important and profound in helping people recover is actually helping people do it. There's so many people. I've actually had a different experience where the information has not been enough for people on its own. There are so many people I talk to who go to so many of these conferences. They will sit here on a Saturday night on Mother's Day weekend to listen to every expert they can, and then they're still going to eat something crappy over the weekend, because it's not just about information, but it's about addiction and culture and emotion and so many other things that keeps pulling them back, or even your environment not being supportive. And so it's been really important for me to help people learn how to apply the information. And I'm also a trauma specialist, and I'm aware of how, you know, with people with autoimmune diseases, there's much higher amounts of people with autoimmune disease with trauma and anxiety and depression. There was one study where they looked at people with autoimmune in the hospital, and those are people who are obviously very sick. And over 60% said that they had had some kind of childhood trauma. So when we're talking about nutrition, diet, lifestyle, for a lot of people, it feels very invalidating, because yes, they want to do better and they're listening, but they don't know how to make themselves do it. And so that's why I even created programs. I work with people every day, because I know I have to get them through all of that time in the beginning, through the food addiction period, through their insecurities, to help them deal with family reunions, to help them through their down days, to help them cope properly through negative emotions, stress at their work, and have them learn how to solve problems, and also how to focus on gratitude. In my rapid recovery groups, one of the most common feedbacks I get is, it's wonderful not to have any more pain, but learning how to be joyful and grateful has changed my life. And so I really try to download all of that for people, that if you can get people into a state of happiness, or they understand how to work through their stress and their food addictions and their peer pressure and everything else, then they can integrate this information, and the healing is rapid and profound. So for example, we just had a group of 60 people go through my rapid recovery program, and every single person in the live meeting had profound results. Many of them were completely symptom-free, and that's talking about 42 days. So the results are profound, but it's getting people into action that I think is the most important. And I also I start with people like, add what you're missing first. Even if you're not ready to give up that burger, all right, well, let's add what you're missing. Let's get you nourished. It'll crowd out some of the junk, and you won't have any of that all or nothing thinking going on, so that we can get you to a place where you will kind of more naturally step into this better way of eating. But every step they take along the way is getting them healthier and healthier with really no downside. I mean, even if you still have a pain left because you're not 100% committed, cholesterol is coming down, blood pressure is coming down, all these other things are happening. And we use that then to compound that motivation to keep them moving forward. And I think also for me, that inspirational piece is something that people can connect to, because I never tell people to do something I'm not doing. It saved my life. And I'm really, I understand the life of chronic illness and how hard it is. And it helps me connect with them in those moments when they're feeling like they can't, and help them get to the point where they feel like they can.
Thank you.
Yeah.
So let me ask you this. So what is the very specific protocol that each of you use when someone comes to you with autoimmune disease or other diseases? What is the exact protocol that you give them?
Well, so these guys didn't come to our lectures? Okay, so the hypernourishment protocol really specific to an intentional overdose in the nutrients for cellular repair and optimal immune function. So the way we create that overdose is with high doses of the vegetables that have the highest dosage of the vitamins, minerals, antioxidants, et cetera, that your body uses. So especially cruciferous vegetables in their raw form, high doses of omega-3 fatty acids. We like flax and chia seeds, they work very well. And hydration, neglected in most areas of health, but water is important for all the chemical reactions that accelerate cellular repair and healthy immunity. So I really focus on helping people nourish themselves as well as possible with those ingredients. And then depending on the level of their illness and how quickly they want to progress, some people will focus on those foods and others will incorporate it into a plant-based diet where they remove the inflammatory stuff that, meat and dairy and processed junk. I won't call it food, processed junk, where they take that stuff out. So wherever people are ready to go, we can start with just adding hypernourishment. We can take out the bad stuff and do hypernourishment on a plant-based diet, or we can do aggressive hypernourishment, which would be the Goodbye Lupus protocol. And then if you include the emotional health and lifestyle changes and working through traumas, then I call that the Goodbye Immune Disease protocol. So it's levels depending on where people are ready to kind of, whether they're getting their toes wet or whether they're ready to dive in.
Yeah.
Thank you.
I think our approach is not entirely different, but just a little bit different twist. When Forks Over Knives came out, I got a little bit of an education because we had always focused on holism. I'm a Colin Campbell fan, and he's written a great book called Whole, Rethinking the Science of Nutrition, but this can be applied to everything. In other words, medicine is a very reductionist enterprise, all right? Everybody sees a gynecologist and a gastroenterologist and a nephrologist and a rheumatologist, and everybody specializes in a body part. Nobody's paying attention to the whole. So that's the first problem that you have. And the second thing is that dietary change, I totally agree with Dr. Goldner that the dietary change by itself won't fix everything. And so there are a whole lot of things that we focus on. One is exercise and hydration. Our people have live classes every week. When people join Wellness Forum, they're told that they will be expected to do research in our libraries. They will be expected to participate in classes, and we offer a great deal of support in addition to the one-on-one help that we give people with everything from making meal plans to role playing how you're going to have a conversation with your doctor at the next visit. But I think the key is that I learned after Forks Over Knives, we got an influx of what I call the sick vegans who were eating perfectly, but they were still in the medical mill. They're still getting a DEXA scan, which is useless for diagnosing bone health. They're still getting cancer screenings that are more harmful than helpful. They're taking supplements from their local naturopath that maybe don't have much value. And so we really look at the whole picture. We basically say, look, we don't want to join the reductionist bandwagon that you're on. Okay, so you keep all that other reductionism going on, and we're going to come over here and just focus on food and psychology. So it's a very whole person approach to health. And the idea is to change the relationship that people have with the healthcare system, not to disconnect them from it, but to make it more like the way that they make decisions about everything. I mean, I've never heard of anybody who stood in the driveway with a realtor and said, I'm so stupid about real estate, you're going to have to tell me where to live. But people will walk into a doctor's office and say, I'm too stupid to know anything about this, so you'll just have to tell me what to do. And my experience has been that if we don't change that dynamic, they will continue to interact with a system that is designed to herd them into sick care. They'll find the more testing you do, the more likely you will find something to pay attention to. And that's evidenced by blood tests. 27 years ago, when I started in this business, people would come in with a blood test that was 2 pages long. Now it gets delivered in a UPS box. And if you're going to look at all that stuff, you're going to find a ton of abnormalities. You can keep people very nervous about their health. And this is the medical mill, by the way. This is the medical mill. We suck you in and we diagnose you with lots of stuff, some of which may not even be real. And then we treat you and we treat you and we treat you and you get sicker and sicker and sicker. And so our goal is to get them out of that mindset that hanging out with doctors and constant testing is the pathway to health. It's not. And they do need a doctor. We won't work with people who are not connected to a physician. So it's not withdrawing them from the medical system that way. It's changing their relationship with it. And we think that's very important.
Actually, I just need to add something to this, just because there's one area where I disagree, that it's really important. People with autoimmune diseases, sometimes medical care is life-saving. And so what I found in my experience working with people is that they do not need to get off their medications to heal. In fact, they recover fully. And then once they've shown their doctors they're well, then they're able to taper off safely. I've been very nervous about it when people will say, oh, I'm going off my medicine for my lupus or other diseases because I want to go ahead and try the nutrition. And I really like to bridge that gap. I mean, I'd be dead 30 years ago without medication. I had 6 months to live without medical intervention, and I had to do experimental treatments that saved my life. And so the good news is, what I found is that the testing and the treatments do not interfere with their ability to recover, but it can keep them alive while they are learning how to incorporate that nutrition, because it's not usually right away that people do what they need to do to eat right to get their health back. And in the meantime, they're racing against a disease that could take their life. So I just want to caution folks not to demonize the doctors that are trying to save their lives. They don't know about nutrition most of the time, although nowadays they do more. I have a lot of people tell me that their doctors are excited that they're working with me. I get referrals from doctors and I educate doctors. And of course, once doctors get sick, they Google and they find us that way too, right? But it is really important to understand that there are, that we can marry the two. And that's where I try to, obviously I'm a medical doctor, I'm a genetic researcher in the past, and I'm also a former patient. And most of the time I'm helping people get off their medicines. But it is, I think, most important for people's safety not to feel like they have to choose a team, that you're either in the realm of natural and avoiding medical care, or you are purely going to follow medical care, but that you can do both. And I do agree that people should make wise choices and educated choices, but that medical care can also be really important for people and keep them going while they're trying to do everything else for their health. And like I said, I haven't seen it interfere with recovery at all for people to be on medication.
Well, I think I've done the worst job ever of explaining what we do, because if anybody got the idea that we're trying to disconnect people from their doctors, that's not it at all.
Well, I heard you say that medications make people sicker and can make people worse, and side effects are real, but medications can also be life-saving. So I just wanted to caution people not to take it that way.
Well, we certainly don't take it that way either. We want people to stay connected to their doctors. And we find that many times people complaining about their doctors, when they go back and they're more proactive about their health, their doctors light up a little bit too. I've told every patient that I've dealt with, if you're going to flop your body in a chair and say, fix me, you're probably not going to get the best medical care available, right? So even doctors that people complain about become better doctors when patients start having conversations with them. I have never in 27 years suggested to somebody that they discontinue their medications without speaking to their doctor and just jump in and do diet. In our world, they start immediately adopting better habits. And while they are doing that, they keep in touch with their doctor. And I'm sure we deal with people who have lots of conditions other than autoimmune. And I'm sure you would agree that a person who isn't withdrawing from beta blockers and calcium channel inhibitors, who aggressively changes their diet, is going to drive their car into a tree if they're not talking to doctors about withdrawing from drugs. So we've never told somebody not to take their drugs. What we are trying to do is to change the relationship that people have with the medical profession. The medical profession has done a wonderful job of convincing people that this is just all so complicated that you have to follow directions. And as I've said, I tell people, you have made very complicated decisions in your lifetime, some of which cost hundreds of thousands of dollars, like buying a house, and you didn't claim helplessness, and you shouldn't do it here. I've never met anybody. I have middle school students who we have been able to make them functionally able to read medical journal articles and understand what they say. And when a medical journal article essentially says, this drug will reduce your risk of something happening by 1/7 of 1%, you have to start asking why you're taking it. When the risk benefit ratio, or the number needed to treat, is completely off the rails, it is reasonable for people to have discussions with their doctor. Listen, if 360 people have to take this drug for 17 years for me to benefit, what the heck are we doing here? I think those are the kinds
being
of
educated is
discussions.
important. Yeah, by 16, I was able to understand every laboratory test that was ordered for me. And most patients I see, no one's ever even told them what the tests are, but they've also never asked. So I definitely agree with that. And for every single person I see, I do 75-minute sessions, and I actually teach them what every line of their lab test says. And they say that's the first time they've ever had that experience. And meanwhile, there's been doctors ordering these tests. They have the tests. They don't even know what they are. So I think that's really wonderful to empower people to understand, and also to then make those decisions. I've always kind of worked outside of the insurance realm too. When I worked for the nonprofit with the homeless, those are such high risk population. They let me do what I want. Even if I wanted to spend a whole day with a patient, if that's what they needed, I would do that. And even now I do the same. But it's unfortunately in the medical world nowadays, doctors working with insurance paradigms, they have 10, 15 minutes and all they have time to do is read a set of labs and maybe order a medication. And it's a disservice to the patients, but also the doctors. Unfortunately, a lot of times doctors are relying like they want to control people, or they want, they're not interested in people's health, where everyone I know who went into the profession earnestly wants to save lives, and then they get frustrated that they can't. So I think it's great if you can empower people to understand your labs, have good conversations with your doctor. I always tell people, don't to ask them to sit down so you can talk to them. Don't let them stand in the doorway. Ask them to sit down and say, I have some questions. I think that's going to be important. And I think that the whole profession is going to need to shift in some way, because it's just the way the system is controlling the doctors themselves really limits their ability to be effective. And I think it's one of the reasons why people are not diagnosed quickly enough, because they just don't have the ability. Yeah.
Okay, so let me ask you a question. You could write this down. I want 10 questions I'm going to ask your opinion on. So I want to get your feedback on these 10 points. And you could just give me what you think. So the first of the 10 things, I'm going to give you all 10, and then you can answer all at once. So your opinion on 1, salt; 2, oil that goes on your food, like hemp, flax, olive, chia oil; 3, fats such as olives, raw nuts and seeds, avocados; 4, fruit. Brian Clement says fruit feeds yeast, mold, fungus, candida, and cancer. 5, hyperbaric oxygen chambers. Are they something special we need to know about? 6, far-red infrared saunas. Is this something that everyone should be taking every day to get all the toxins, heavy metals, and pest poisons out of our body? 7, supplements. Are there a list of supplements that you recommend everyone takes? 8, fasting. Should this be a regular part of our life? Should we be fasting every year for a week on water? 9, what medical tests do you recommend healthy people get? Is there any that you recommend we get once a year, once every 5 years? And number 10, are smoothies okay because we're concentrating the fruit and making it more sugary? So is that an appropriate thing, or is it too sweet? So if you could each tell us your feedback on these 10 things, that would be great.
You want to go first, Brooke?
It's all right. You got it.
Okay. There's no reason for most people to restrict salt. About 5% of the population has an issue with salt. And the research is becoming increasingly clear that when you restrict salt to extreme levels, you bring on some of the same problems that excess salt brings on. And by the way, one of the reasons that this becomes important is that if we're looking at how to make this easier for people to do, Salt, people like salt. We have taste buds for salt. The argument for eating fruit is we have taste buds for sweet. We have taste buds for salt, but we're going to ignore that. Doesn't make a lot of sense to me. But the research is quite clear. I've written several referenced articles on this. I think getting the oil out of the diet for the most part is a good idea. I don't think you have to become ridiculous about it. I watched somebody with abject horror wiping off asparagus in a restaurant with a towel because it had a little shine to it, claiming that she was going to die if she ate it. I don't think that that brings people to the table saying, I want to be like her. Let's talk about healthy eating. It's kind of bizarre behavior. But having said that, 2/3 of the people in our country are overweight or obese. And so a product that has 14 grams of fat per tablespoon is a little counterproductive if you're trying to address that. High fat foods, it's the same thing. A cup of avocado has 21 grams of fat. We don't take these foods like cashews or avocados out of the diet. We basically suggest that when they're in a dish, great to have, but people go to the grocery store and buy 5 avocados and go home and figure out what to do with them. We're going to put it on toast this morning and we'll put it in a salad tomorrow. And they have no idea the calorie and fat density of the food that they're eating, and then look at their weight status and say, I don't know how this is happening. I'm eating plant food and that sort of thing. So I think there's a place for higher fat foods like avocado, but it's at the top of, we have a food pyramid that shows people the eating scheme, and it's closer to the top. There's no problem with fruit. I've never read a study that shows that there's any problem with fruit. Type 2 diabetics do not become diabetic because of fruit. They become diabetic because of fat, too much fat in the diet. Glucose escorts fat into the cells, among other things, insulin, escorts fat into the cells as well as glucose. And one of the things that happens when people adopt a lower fat diet, if they're a type 2 diabetic, is that fat comes pouring out of the cells, and results are pretty fast in terms of reversal. I think there are uses for hyperbaric oxygen and infrared sauna. I'm very reluctant to have these very long, complicated lists of things you have to do to be healthy, because we have to recognize a certified public accountant during tax season can't quit preparing tax returns because I got to eat these 12 foods for lunch, and then I got to do this, and I forgot to do that, and I got to go sit in a sauna. Having said that, I have a rheumatoid arthritis patient who one of the things she's done to keep herself from deteriorating and taking medications is she has a sauna in her house. I think that's great, but to suggest that everybody should do it, I think is a little misguided. I think B12 supplements are important for people who eat a vegan diet. I take one. I think a probiotic is sometimes helpful. And then after that, it's depends on the condition. So this idea, here's the 12 supplements I think everybody should take. Gosh, it just makes you wonder how humans survived when we had far fewer food choices and we're wandering the earth, and sometimes we didn't even have enough to eat. So I don't really agree with that. I think fasting is wonderful. I've sent about 500 people out to Alan Goldhammer's place, and I've sent dozens to Dr. Gracie's place right here in Ohio. I think it's fabulous. Does everybody need to do it? No. Is it a good idea for some people? Can save their life for many people. Medical tests recommended. The only test, the cancer screening test that actually has been shown to reduce the risk of dying of cancer is Pap testing. We now have even a randomized control trial. We didn't have one until late last year on colon cancer screening, showed it's useless. Doesn't even prevent, all that polyp snipping doesn't even prevent the development of colon cancer, let alone dying from it. And there is no evidence to suggest that there's any problem with smoothies. And one well-known doctor has a couple of references on his website for that. We checked them out in a research class I teach, and they don't say anything about smoothies. If you go read those studies, they absolutely are not an argument for not consuming smoothies. So if people like smoothies, that's fine to eat smoothies. I have one every day myself. But if you don't like them, there's no mandate to have them either. I think everybody's different in that regard. So that's my quick and dirty rundown of 10.
Thank you.
All right, I just go the quick and
Yes,
dirty
please.
rundown.
Yes, thank you.
All right, I totally agree. I don't see any reason to limit salt. In fact, I get people to drink a ton of water, and people don't realize that when they go from a processed food diet, they don't realize how much salt they're usually eating, not even adding it to their foods. And then when they try to get healthy, they give all the processed junk, and then they stop all salt. They start drinking a bunch of water. Next thing you know, they're woozy because their blood sodium levels are too low. So I actually recommend that when people switch to hyper-nourishing plant-based diet, that they actually incorporate about a teaspoon of salt a day if they're adding all this water, because we do need a little sodium. And when we completely eliminate it, you can have problems. And I've actually had people not listen to me about that and have problems where they got dizzy. And if your blood sodium gets too low, you can have seizures. I mean, it's serious business. So about a teaspoon a day usually works for people. And that, again, that is not the same as folks who are overeating sodium, and they also have hard arteries from overeating butter too. And that's the other problem. So, so sodium, I've not seen a problem. Glad to hear someone else agrees with me on that one. Oils, in general, I'm not a fan. Coconut oil raises your cholesterol, and all the animal products, you know, all those oils and saturated fats are bad for you too. Olive oil, avocado oil, I've seen people get away with using that sparingly. It's not an inflammatory oil, but it's not good for your health. The only ones that I've seen to be health promoting would be something like cold pressed flaxseed oil, because it's high dose omega-3 fatty acids, which actually brings down inflammation, stimulates the pathway to create your anti-inflammatory immune system, increases your metabolic rate, incorporates into cell membranes, incorporates into your neurons. So those are really important fats. And of course, if you're afraid of oils, don't want to use them, you can use things like flax and chia seeds, but I have helped people reverse disease successfully using flax and chia oils. And so there's no reason to be afraid of that one. People are so afraid of fats, especially in the plant-based movement, but there are ones that are actually helpful for healing. And so, like I said, flax oil would be one of those exceptions. Now, going to fats in general, fat phobia is rampant. And there's a lot of misinformation about that. I have a lot of stuff on my YouTube channel about this as well. So it's really important to understand that eating whole plant-based fats do not increase your body fat. So for those who don't know my background fully, my husband has his own best-selling book, Miracle Metabolism, and we came into understanding the impact of nutrition on cellular repair and metabolism because of his research. So he was getting his master's degree trying to understand what the right human diet is for fast metabolism. And coming from a computer science mathematic background, he thought when there were algorithms that people used in biological science. And boy, was he shocked when he found out that PhDs in biology don't know what humans are supposed to eat. And so it really perturbed him. And so he was obsessed with figuring out the right foods to create a fast metabolism. Was very successful at that. And the plant-based version of that is what reversed my lupus all those years ago. It'll be 18 years, not 3. So anyway, it all came from his fat loss protocols, and they work. I did his program actually to lose weight for our wedding. He wanted to marry a sick woman who couldn't have his children and take care of me. And so I did his program, and within 3 months, I went from a size 11 to a size 3. And, you know, I lost the lupus too. So, but what we found is there are certain fats that make you sicker. At the time I was a vegetarian, and so I ate a lot of dairy and eggs. And so I had to take that out of my diet. But I was able to eat other fats like avocados in an unlimited way. In fact, I usually ate about 3-4 avocados or more a day, and body fat dropped really, really quickly. So we've actually tested all the different kinds of fats. He had the largest boot camps in Orange County, California. So he was able to test different foods with the same exercise program to see what happened. So we found that olives, avocados, even nuts and seeds do not inhibit fat loss. When you're looking at autoimmune disease reversal, I don't recommend people go super high in the nuts and seeds because I'm trying to fix their omega-3 to omega-6 ratio. So if you watch my class, I went into that a lot. And I actually have free classes online right now where you can, if you want 5 hours to learn for free about these pathways. But nuts and seeds are heavy in the omega-6. When you're healthy, the range is actually pretty good to maintain health without worrying about it. But if you're trying to reverse disease, I would keep those minimal. But in terms of body fat, those are all really, really safe. And also in terms of other things, I've been telling people forever that avocados do not raise cholesterol. And now they've shown in research that plant-based diet with no fat, cholesterol comes down. You add avocados, it comes down almost twice as much. So more and more research is validating what we've been seeing over the past, almost 20 years. I have no comment on hyperbaric oxygen or infrared sauna because I only speak about things I have results for. So I have found that the worst thing that anyone can do is give a theory when they don't have results or experience. So since I've never tested hyperbaric oxygen and infrared saunas to see what happens to people who do it or don't do it, I won't comment on it. I would say if you like it and you feel better doing it, then do it. If you don't, then don't. But I don't have an opinion because I haven't tested it. Supplements for all people, B12, D, probiotics. For most people, probiotics. Not everybody needs them, but a lot of folks transitioning from a meat-based processed food diet to a plant-based one can have some GI upset. So that can be helpful, but definitely B12 and D And I've heard some controversy about vitamin D lately, but in my own experience, again, working with people with autoimmune disease, what I saw is that autoimmune antibodies were spiking in people with low vitamin D, and just supplying the D brought the antibodies back down again. Found more articles to support it in other practices as well. So I think it's a dangerous thing to neglect, especially since most of us spend our life indoors, and 15 minutes a day in the sun doesn't fix it. Let me see what else. The next one was fasting, water fasting. That one also, my experience with it is varied. So I don't personally put people on water fasts. I've had folks tell me that they've done water fasts and it helped them overcome their original food addiction and transition better. And I think that's wonderful. And I've gotten referrals from places where people do water fasts. But I did have one client who had already gotten healthy. He'd reversed his disease completely. His lupus was, all of his labs were negative. His kidneys were working again. And he went and did, he wanted to do a water fast with a friend out in Sydney. It was supposed to be 30 days. And within 2 weeks, his bone marrow failed. He ended up in a coma. And the autoimmune markers all came back. And I talked to some of my friends that I just saw in the last group. And their only theory was maybe he already didn't have much body fat and he went into starvation, but it gave me some trauma. So I know if it's medically supervised, like our friends in California doing, they probably would never see something like that. I mean, this was supposed to be medically supervised, but I don't know, they missed it. But it gave me some fears about it. So I don't know. So I'm a little hesitant because I had that one experience. But I think for most people, it's probably a good head start. But it's not necessary, because by adding the nourishment you need, you're going to get results that really will stay. And that's what happens a lot of times is people feel better fasting. And then when they eat again, things come back. So I would just be careful and make sure it's medically supervised and that they're doing blood tests if you do it. Medical tests. Again, I do live in a medical world, and I think it's important to be careful with your health. So I personally just got my mammogram, my colonoscopy, my pap smear, and was told that I have the insides of a teenager, and that's great to know. My colonoscopy afterwards, he actually applauded for me. I have had family members die of colon cancer that was not found in time because they were not getting their tests. So I do wish that the whole world ate plant-based and lowered their risk of disease and not needed them, but there are still people whose lives are saved from this. I actually just read an article recently about a woman who did not get a mammogram because she was told they were bad. By the time she got it, she was only months away from death from metastatic breast cancer. So I caution people, I'd rather people take the tests and know for sure, even if they are uncomfortable and even if they sometimes make you come back, then miss a chance to diagnose something that might be important for you to know. So I still recommend people get those tests. And smoothies, you already know the answer, Steve. So we have found that making green smoothies has been the way to get people to hypernourish. When I healed from lupus almost 18 years ago, I ate pounds of raw broccoli and cauliflower just dipped in guacamole. That's how I ate all those avocados. And that's how I got it in. And I got rid of lupus. I lost the fat and I had jaws that could cut through a steel door. But I have found that it's very hard to get people to eat pounds of raw vegetables, especially when they've never eaten that way. But if you put it in a blender and throw in a handful of flax or chia, you put in your favorite fruit and water and you blend it, people will drink it through a straw and it will save their life. So yes, some current research has shown that you actually absorb more nutrition through a smoothie than you do if you chew up that same amount of food. But we've seen in thousands of people all over the world is that it is a fast track to getting people to get the nourishment they need so that they can get healthy and not need to hang out with so many doctors anymore. So that's my 10.
Okay, great. So I want to ask you another list, but this one we'll just do 2-second answers for each one. So this way,
2 seconds. Oh my God, do you know us?
just based on time, we're not going to get to hear your reason, but we just want to at least know your take on these. Okay. So I'll say there's 15. I'll ask them out loud one at a time, and you could both answer with either a yes, no, or a very, very, very short answer. You ready? Okay. So,
I feel like I'm on a game show.
Sunshine, is this significant either way that we get sunshine each day? Does this really matter, or is it not a big deal either way?
It's a big deal. A lack of sunshine will shorten your life the same as smoking cigarettes.
Yes,
research
for
shows.
emotional health especially, we got to go outside and touch grass, see the sun. Absolutely.
Okay, there's something called grounding where you walk barefoot that they say lowers inflammation. Is this something you recommend that we take an hour of our day to walk around barefoot? Is this worth it, or do you have any thought on it?
I think the harder you make this, the less takers you're going to get. I think it's great to be outside. I think it's great. I like walking around my yard barefoot, but I don't think it's a requirement. And to suggest that you can eat cheeseburgers and put your feet on the grass and get rid of it's kind of silly.
Agreed. I find it calming. I find a good meditation, but I've never tested people who stand in grass for an hour versus people who don't. So I can't tell you if it's required. Most people who I work with don't do it, but I think it's good for you. Whether or not it's really anti-inflammatory, I can't say.
Okay, there's a new book by Sally Norton about something about oxalates, saying that it's toxic. Do you have any thought on oxalates? Whether or not this is something that we should change our diet to avoid?
I have thoughts on everything, Steve. Listen, your body makes oxalates. Okay, so and by the way, when you have a problem with oxalates, it's usually because you've been eating terribly and your body's making oxalates. And this is a ridiculous thing, trying to stay away from oxalates because you have kidney stones. So that's all I'll say right now.
I just put a video out this week about the myth of oxalates. Yeah, this is a distraction. People are not dying from overeating spinach. They're dying because they're not eating spinach. All right. So yeah.
Yes, thank you.
What about acrylamides from eating cooked foods or cooked beans, grains, breads? Is this a concern that we should not eat cooked food because of acrylamides?
It's ridiculous. And again, why make this harder than it needs to be? Some of our colleagues want this to have all these rules, and then they sit back and say they can't understand why people won't do better for themselves. Well, if they're looking at this and saying, I got to quit my job and think about eating all day long, you're not going to get many takers. There's no evidence to suggest that cooked food is harmful.
Now, I don't think acrylamides are the issue. And again, I think it's a distraction. And there's so many people trying to distract people from just eating better. It's just
okay. Do we even need to have this conference? Can we just take Ozempic, which is a diabetic drug, to lose weight?
Well, look at we're the only country in the world that allows drug companies to do a clinical trial without testing it against an existing drug like metformin that is already cheap and works. All right. So none of these drugs would be on the market if they were tested the way they are in other countries. So we don't need any of these drugs. These high-priced drugs, Trulicity, higher price than some of these drugs than the average income in our country. It's ridiculous.
It's human hubris that somehow we're going to invent a better way than nature. And it just hasn't happened yet. My mom was told that giving me formula was better than breast milk. Turns out not the case. No, we're not going to have a pill that replaces common sense and healthy eating.
Okay, how about alcohol?
It's a treat. I don't think we get anywhere telling people that a cookie is going to kill you and cake on your birthday is going to end your life. You got bigger problems than I can solve if that's the case, right? I collect wine. I'll have a glass of wine maybe 10 times a year. And as a treat, I don't think it's a problem, but there are a lot of doctors encouraging the consumption of alcohol for health purposes. I think that's dangerous.
Yeah, it's not a health food. If you're sick, I don't recommend it. If you're healthy, then it's something I call it recreational eating, recreational drinking. You know it's harming you, but if you do it once in a while and you're healthy, it's okay. I also have a glass of wine or maybe even a martini once in a while, but I've been healthy 18 years. When you're healthy, you can take some risks because your body can handle it. When you're sick, though, you got to be much more careful and realize that your body's a lot more delicate than that. So know if you're sick, but if you're healthy once in a while, it should be okay.
How about coffee?
No evidence that it's harmful. One of my affiliate colleagues and I wrote a very long paper, 25 pages, more reasons to take up the habit than eliminate it. Actually, I don't think people should start drinking coffee as a health food, but I don't see any reason to talk most people out of it unless they're caffeine sensitive.
Yeah, and I've had people who've completely healed from their autoimmune diseases while still having 1 cup of coffee a day. So if it doesn't hurt, then it's fine. But multiple cups a day, now you're taxing your adrenals, you're putting your body through a lot, you're preventing yourself the ability to sleep properly. But 1 cup a day of coffee has not stopped people from healing, in my experience.
How about
Good
eggs?
news.
Go ahead.
I said it's good news. Most people are very scared of losing that coffee.
How about eggs or egg whites?
No.
We don't teach a vegan diet. We basically teach people to eat a diet that has a very small amount of animal foods. A lot of people become vegan because they decide to later, but 2 to 3 servings of organic animal food, as long as there's no dairy, it's wild caught or organic, I don't think is harmful. That hasn't, certainly that's the way people around the world who live a long time eat. I think there are some people who are sick enough that they should entertain the idea of eating none, but most people can continue to eat some. And if it will make them do everything else, I'm all for it. In other words, we've got to make sure we're not throwing out the baby with the bathwater.
In my experience, that it's prevented people from having their recovery. I myself was only eating some cheese and eggs. Taking those out were pivotal to my health. And actually, right after I recovered, I hadn't known why, because I'm a doctor. I didn't know my diet had anything to do with it, right? So I had added eggs and egg whites initially, and then I started getting inflammation in my bladder and all sorts of things that nobody could help me with. And then my husband was like, it's weird that came back when you added the eggs back, took them back out, everything disappeared. By the time people see me, usually everything else hasn't worked. So they've tried paleo, they've tried all the other things, and they're still really sick. They don't want to go to the lady who makes them eat raw vegetables first. So in the folks that I've seen, even eating a bite of animal products has kept them from that full recovery. Sometimes they can get better, but then they get stuck where they still have positive antibodies, are not fully recovered. So I have found for the majority of people, they need to become completely plant-based. I had one example from my classes of a man who was symptom-free with minimal medication, with only eating meat once in a while. And then once he removed it completely, within 2 weeks, his blood tests were negative, and he's never had a relapse since then. So I think any step you can take in the right direction is going to be good. But for optimal health and the fastest recovery, even eggs have to go.
How about cooked mushrooms?
No problem. The cooked mushrooms, I have 3 lectures on our cancer site on the effects of mushrooms on as a form of therapy for cancer, along with a comprehensive plan. So I think mushrooms are great. If you don't like them, don't eat them. I mean, we've tried to focus on the idea that this whole idea that you have to suck it up and eat food you hate because they're healthy, that's counterproductive. But if you like mushrooms, no reason to not have them.
I like them, but I like them better raw. I know people are scared of raw mushrooms, but I've never had a problem with them. So, but yeah, I don't see any problem.
Okay, what about memory issues? What do we do to not lose our memory and to keep it and regain it if we've lost some?
Diet has a lot to do with it, but it's more than that. It's social engagement. It's people who retire early and don't have enough to do. That's dangerous. Hydration, sleep, a whole lot of things. Exercise. So if you want to be cognitively and physically healthy and live on your own until you die, and I've got a almost 93-year-old father living on his own right now, you've got to pay attention to a whole lot of things. He needs, for example, intellectual stimulation, right? So we talk to him all the time, play cards, watch TV together, watch a movie, that sort of thing. So social engagement and learning, use it or lose it for muscles. Same thing with brains. You have to use your brain or it atrophies, right?
Agree 100%. Also, omega-3 fatty acids, they found ALA, which is flax and chia seeds, is important, as well as EPA and DHA, which your body pulls from that. If you're not eating other animal products, your body can break those down pretty well. So they've shown those alone have improved memory function, even in people with Alzheimer's. Avoiding animal products, again, they make a big difference. I was talking to some brain researchers have found the strongest connection between diet and Alzheimer's to be eggs and chicken. I'm like, oh my God, that's what people eat when they're trying to eat healthy, right? So diet makes a big difference. Exercise is one of the only things that can actually increase brain size is exercise. So exercise and then everything else that you just heard from Dr. Popper.
What about eating cheese?
I think, there's only one food group that I think bears just eliminating, and it's dairy. And the reason
Hallelujah.
Too many problems. I mean, we show people it contains estrogen and estrogen metabolites, and it doesn't matter if you buy raw dairy, it doesn't matter if it's organic, and it doesn't matter if you got it straight from the farm, you're still stuck with a product that contains estrogen and estrogen metabolites. And the molecular mimicry aspect of dairy protein and type 1 diabetes, the beta cells that produce insulin, having a close resemblance to, in terms of the amino acid chains to the dairy proteins, I think is a real issue.
Yeah, dairy has to go.
What about fish?
I don't see any reason that people can't have some fish. Again, I don't think it's a matter of which flavor other than the dairy. I think it's a matter of keeping it at a very tiny part of the diet. The Okinawan women are not vegan, all right? They never got that memo. But they eat a very tiny amount of animal food and an enormous amount of vegetables and sweet potatoes and that sort of thing. So a little bit of fish, if it's wild caught in the context of a diet that is almost all plant food besides that, I think is fine.
Again, it depends on how healthy you're trying to be. If you want to optimize your health, you want to avoid all animal products. Remember when I was learning about the different types of cancers found throughout the world, they're different depending on our diets, right? So people eat lots of beef tend to have more colon cancer, but then in Asia where people ate more fish, they had more stomach cancer. So it's kind of like, how often should you smoke in order to not get emphysema or cancer? Well, better not to smoke. So I recommend people avoid all animal products. I mean, fish absorb all of the pollution that rains down into the ocean. They have found them to be positive even for nuclear waste. It's taking a risk. So, and then the parasites, I just don't see the reason when you can have better health without them. But if you're already healthy and you want to use them to get high sometimes, just make sure that it's minimal. Again, it depends on your health goal.
How about grass-fed beef? Not regular beef, but grass-fed.
Again, I would say organic and small amounts of it 3 times a week. In other words, this whole idea of eat less of something, nobody knows what eat less means. We use very prescriptive communication. So grass-fed doesn't necessarily mean anything. Organic is much more meaningful if you're going to buy animal food.
If you are going to eat meat, it's a better choice. But if you're trying to optimize your health, then you're going to take all meat out, including the grass-fed. They still are more inflammatory. They drive the inflammatory immune pathways, and it's going to have a higher chance of making you sick.
How about fermented food like sauerkraut?
If you like it, eat it. If you don't, you can live to be 100 without ever touching it.
Same. If you like it, eat it.
Okay. How about cold plunging, jumping into cold water? Is that?
I hope that's not necessary because I can't do it. Whenever I've gone to a spa and they have a cold plunge, I put a toe in and I can't do it. I don't know if there's a health benefit to it. I think that's one that do it if you like it. Maybe.
Yeah. I think it depends on the person. Wim Hof has some very interesting videos about breathing. James Nestor also, and Hof uses cold plunge, and he's helped a lot of people recover from trauma and that sort of thing.
Ooh.
That way, I don't like it. I hate cold. I'm
Me
a person
too. I'm
who,
not a fan of cold.
I would live in the hot yoga studio that I own if I could. If the electronics didn't go bad in there, I'd just sit in there all the time.
Okay. Amy, would you like to ask a question, and where are you from?
Yes, I'm from New York City, and this question is for Dr. Goldner. Just yesterday, I was diagnosed with antiphospholipid syndrome, and I know you also had that. I'm wondering, do you still use blood thinners to avoid clots?
Hi, Amy. Where in New York City are you from?
Brooklyn.
Brooklyn. That's where I was born.
Oh, wow.
Maimonides Hospital.
Oh, wow. Not far away. I'm in Bay Ridge.
Okay, there you go. Both my parents are from Queens. Okay. Anyway, so we're just bonding. So yes, I had antiphospholipid antibody. I developed that back in about 2006, I believe. And it was major. I had high antibodies and I actually had mini strokes. I do not take blood thinners actually, because back in 2005, when I changed my diet, those antibodies went away. And thankfully, with antiphospholipid syndrome, you can track the cause of the blood clots, right? So having antibodies creates those clots. So the antibodies were gone within 4 months. And I continued, I took injections for my blood thinners. And so I injected myself every day. And after a year of no blood clots and no antibodies and no lupus, I finally asked my doctor, so why do I keep taking these shots every day? And he said, because you're treating my anxiety because I'm afraid to take you off them. I went, okay, well, I don't want to make you anxious, but I can't, I mean, because you're constantly bleeding, right? I mean, I'd get a paper cut and I look like something out of a horror movie. So I stopped them because medically I was no longer necessary. And we kept tracking my blood tests frequently. I don't want to die. I don't want to have a stroke. And even when I decided to get pregnant, we tested me regularly and I never had a relapse. If I'd had a relapse, I'll take the blood thinners because I don't want to die. I don't want a stroke. But I've never had a relapse in almost 18 years now, and I haven't needed to take any medicine. What I found in my clients is the same thing. Usually those antibodies will go away rather quickly, like in rapid recovery, often by 6 weeks, they no longer have antibodies anymore. And so oftentimes people will decide at that point not to take them. Other folks don't like the idea of not taking a blood thinner even without antibodies, and they might continue with a baby aspirin or something, or only take it when they're pregnant. That's something kind of personal for you to figure out, but at least you can get rid of those antibodies, which was a huge relief, at least for me.
Roger, would you like to ask a question, and where are you from?
Roger Test, Cokeville, Wyoming. I've heard Dr. Goldner mention the mutual love between her and her grandmother. How long into your career, your health journey did she get to see?
My grandmother passed away 5 years ago at 99. So that same grandmother who begged God to take her life so that I could live when I had kidney failure, she lived another, gosh, almost 30 years, 25 years, and saw me survive, graduate high school, college, medical school, get married, have children. She taught both of my kids to walk. So yeah, it's got to bring up my grandma, make me cry. She got to live and see all of it. Thanks for asking.
Dominic, would you like to ask a question, and where are you from?
Hi, I'm from Quebec, Canada. And my question is for Dr. Goldner. I'm wondering what would happen to your condition if you would come back to this sad way of eating, the standard American diet? Yeah, would you get, do you know? Well, yeah.
Well, so it's Dominique, right?
Yes.
You know, one, I'm not going to test it. So I like to speak to results, not to theories, right? Not going to test it. I have no desire to go back to the way I ate before. I have 2 beautiful kids. I've got such a good life. And at 46, I have 0 health problems. So I'm really riding this wave as long as I can. But I mean, theoretically, which is where I hate to swim, but okay. I think that it would take a lot of bad eating to get myself sick again. By the time I got diagnosed with lupus at 16, I was formula fed, given baby food. Chef Boyardee was my private chef, macaroni and cheese. And my parents bought a pizza shop, and I ate pizza for lunch and dinner every day. So, I mean, lupus was built on processed foods for me. So by 16, that's how long it took me to actually be sick, right? Now, by then I was already in kidney failure, but so probably 14 was when I started to get symptoms, right? So now that I've been healthy for 18 years, and I literally live on green smoothies and salads and a little bit of like soups and quinoa here and there, something, I think it'd be very difficult for me to get sick again. If I tried really hard, if somehow there's some new mosquito that makes people want meat instead of the ones that make people allergic, I don't know. I mean, I guess there's a potential there for me to get sick, but I have no desire to do that. I don't feel like I'm missing out. I was missing out when I was sick. I'm not missing out on anything now. So and there's always a potential. Now with my clients, if people go off the wagon too quickly, like if they are symptom free in 6 weeks and they go, oh, I'm done, and then they eat a cheeseburger, they often will feel some symptoms. And I use that. I say, hey, you did your research, you're ready to come back, and then they'll come back. So if it's early on in the healing process where it's like you have a newly formed scab over that wound, you can get yourself symptomatic again. But I found once people are healthy, asymptomatic, negative labs for at least 6 months, they can have the occasional inflammatory something once a week or so, maybe, you know, something with oil or something with sugar, and they don't have any symptoms at all. So, so yeah, I don't know. I'm not willing to do the research for you.
Okay, last 2 questions. Elizabeth, would you like to ask a question, and where are you from?
Yes, please. I'm from Quebec, Canada. So I have a question, Dr. Goldner. I have arthritis since last year, and I saw it was related to organic grains. And I was wondering if in your program, if you had to restrict those or not, and also organic soy milk, is that a problem or not? Please.
Are you doing better now?
Yeah, it went away. If I take out the grains, it goes away. If I just eat whole wheat bread or just homemade sourdough bread with einkorn or whatever, it starts over in a day or 2.
Yeah, so there is no grains on my healing protocol. There are people who are able to tolerate some. I have found people are not typically allergic to gluten so much as the processed foods that the gluten is in, processed flour, stuff like that. But if you do have a sensitivity to grains, I would just take them out. They're not a part of the healing plan. It's just something people look forward to adding back when they're healthy. Soy milk, I have seen problems with. I think whatever they do to turn it into the soy milk is a problem, because tofu and edamame I've not seen problems with at all. But sometimes people have what looks like an inflammatory reaction to soy milk. So usually when people are on my plan, I actually recommend they use the unsweetened almond milk, just because that's the one we've been using since the beginning. And unless someone has a nut allergy, it's worked really well for people's recovery.
David, would you like to ask a question, and where are you from?
Hi, this is David from Massachusetts. If a vegan person has an omega-3 deficiency, although he eats a bunch of nuts and seeds, including flax seeds, would you recommend take supplement, and what type of supplement? Thank you.
So are you saying that you did like a test?
Yeah, blood test for omega-3 and find a deficiency.
I don't really trust those tests very much, because they're looking at the blood level versus the level of omega-3 that's been incorporated into your cell membranes. So I teach a lot about the omega-3 pathways. I think that you can absolutely get the results we know happen through omega-3 supplementation or getting enough omega-3 just by eating more omega-3s. So I would say to have at least a half cup a day of flax or chia seeds, or a couple, 3 tablespoons or so of flax or chia oil cold pressed, and you should be able to get the benefits of having those omega-3 fatty acids. Those tests, I just don't think they're very reliable, because again, they're not looking at the level of incorporation of omega-3s into your body, but rather just your blood levels.
Pam, did you want to comment on that last question at all?
Yeah, I think that nutrient testing is dicey, because nutrient levels fluctuate from minute to minute. And I think that it depends on the lab that these specimens are sent to. There are some labs that find everybody to be deficient in everything. That's the whole point. And so I think you have to be careful who's running the test and where it's being sent to. I think the better way to look at this, I mean, there are definitely some times when you have to do this kind of testing, but I think the better way to look at this is not to try to micromanage your blood work minute to minute. It's to say, okay, what's the totality of the way that you're living your life? What are you eating? How much exercise? You're getting out in the sun? Are you drinking enough water? What's your life like? What are your stress levels like? Are you happy? What kinds of changes do you need in your life? That sort of thing, that paying attention to the whole. I think that one of the shortcomings of medicine is this reductionist approach. We're paying attention to everything but the totality of the patient's experience and living. And I like to get back to paying attention to that. I'm healthy for a whole lot of reasons. I eat well, and I'm hydrated, and I exercise, and I have a great life. I'm like Dr. Goldner. I have a great life filled with great friends and meaningful work to do. And I think all of that's all part of the picture of health, not micromanaging. Am I getting enough omega-3, and what does my blood test show?
Dr. Popper, do you eat a whole food plant-based diet?
I do. I'm a well-known vegan, and I'm glad I made the choice. I did it for my own reasons. So my advice to, and I tell people, it's great if you want to adopt a vegan diet, I can show you how. I think that the biggest thing that I've seen, we are involved in community health. We get everybody. We get people who are 18 years old and they're 20 pounds overweight. We get people who are 50 years old and have 19 diseases and take 11 drugs and 2 pages of supplements, right? And so I don't think you can do a one-size-fits-all approach. And so what we've basically done is we have a diagram that shows people how to eat a health-promoting pattern. And it works for everybody. We have had great success with people getting healthy and restoring their health with this pyramid. Our goal is to get lots of people to do it. And it's not so much about what I do. The name of my company is not I want to be like Pam. The name of my company is Wellness Forum, because I'm crazy. I mean, I'm a lunatic. If there's a term called wretched excess, if you look for it in the dictionary, that's me. That's the way I do exercise. That's the way I do food. That's the way I do work. It's the way I do everything, but it's not necessarily the way that most people want to live their lives. And certainly people who are not in the business of taking care of themselves all day long, like I am, right? So yeah, I eat a vegan diet. I adopted it 30 years ago. Super glad I did. Have no intention of going back. But what I'm doing with the public is not about me. It's about what we have to do to get those people to make permanent change, because 30 days of perfection is not it. It's 10 years of doing really, really well that matters, right? That's the goal. Year upon year upon year of sticking with it.
Okay, do you want to each make a 15-second closing statement?
You go first.
Okay. So first, I'm just grateful for all of you guys who decided to stick around on a Saturday night to ask us questions. And it means a lot to me, because what matters to me is that you do what it takes to take care of your health. I'm on a mission to try to inspire and educate people to live better lives, both for you, but for the people who love you too. So find the motivation inside yourself to start. And if you can't find it for yourself, look around at the people who love you, look for the people you can inspire, find something that can spark it in you, and just start where you can. But remember that it's important, and that you are important to other people, that you need to start taking care of yourself. So I hope whatever we've been able to teach you and talk to you about, that this is the moment that you really feel inspired to take care of yourself.
Yeah, I echo that. I think it's really important. And I try to use humor to deflect the seriousness of things sometimes. People take care of other things much better than they take care of their bodies. Have you ever seen somebody driving on a flat tire for 6 weeks and you say, did you know your tire's flat? Well, I know, but I got kids playing soccer and a lot of overtime at work, so I just don't have time to fix the car, right? Have you ever been at somebody's house where it's raining inside and you realize you need a new, oh yeah, I know, but you don't understand, we're taking a vacation soon. And people don't put off maintaining other important things. And my gosh, people, your body is more important than your house or your car. I'm not saying don't pay attention to those things, but think about, you have one body. And if you take care of it, you can have a long, spectacular life, because health allows you to do that. If you don't take care of it, your whole life gets tied up with sickness. It becomes your full-time job just to manage the doctors and the drugs, and it is not a way to live. I watched my mother do it, and it really inspired me to make sure that I did not go down that same path. So take advantage of all the great stuff you learn at this conference. And Steve, thank you so much for doing this every year. We really appreciate it.
Thank you both. We really appreciate you both sharing yourself so freely and having so much brilliant information that you took your time to find out, and then you share with us. I want I find that in today's world, it's, getting a doctor's appointment is a whole production. Sometimes they don't have an appointment for a while. It's hard to get them on the phone. So for people like you to, for free, come and share amazing information, we really value it. It's not so easy to get. So thank you very much. I'd like to unmute everyone. So anyone else who wants to thank you.
Thank you.
Thank you very much.
Thank you.
Thank you so much.
So amazing. Thank you so much.
Wonderful.
I can't wait
Ladies,
to-
Good job.
Yeah.
Thank you.
Thank you, ladies.
Bomb,
Thank you.
Dr. G.